You're on live. You're on. Hello, I'm Jerry McIntosh, and it's Friday, 6:30. We this is Let's Talk. Let's Talk COVID. Something we've been doing every Friday, and we will continue to do to make sure that we make people aware. And this is our goal, to make sure that everybody, as much as possible, get vaccinated, get masked, and get information on it. So we try to do our best to give the best information that we possibly can. But I'm gonna go to our host, Mr. Derek Scott, who is with the Pensacola Black Caucus and also the White House Task Force on COVID. We have Dr. Isaac Williams, who is the great pastor of Greater True Vine Baptist Church, and also the moderator for this area, and also with the task force on COVID. So, and then we have Carol McIntosh, who is a former educator, principal administrator, and now the president of the Progressive Black Women. So, Carol.
All right, good evening, everybody. Another week, and we're all here safe. Dr. Williams, I know you're tired. He just got off the road, but he's so dedicated, he came on today. And Derek, we're so happy that you joined us and joined the show and offers your expertise. I'm a little hoarse today, so please bear with me. Let's start off with, we only have an hour, so let's start off with Dr. Williams. Dr. Williams, can you give us a little summary or an update on what's going on with the virus?
Thank you, Ms. Carol. Good evening, our distinguished colleagues. Well, what do you need to know about the coronavirus right now? Well, know that Medicare will cover at-home testing kits. So you can get some testing kit. Please go out and get your at-home test kit. Pfizer just recently asked the FDA for authorization to cover the COVID-19 vaccine for young kids. I think that's very important. FDA has fully approved Moderna's vaccine. I think that's important for us to know. So Pfizer is fully approved and Moderna is fully approved. And FDA stopped approval of two of those monoclonal antibiotics treatment. And they're saying that they're no longer gonna allow people to receive those type of treatments. And I think out of all the information that we're going to discuss tonight, I think the most important thing is that unauthorized adult Americans are nearly 50 times more likely to become seriously ill, hospitalization or death versus their peers. That's startling. 50 times more likely to become severely ill, hospitalization or die than their boosted counterpart, their boosted peers. And this what research has revealed is that the vaccination rate for American is strictly, the reason the low numbers are strictly because of partisanship. Partisanship. And I just wish that I knew how that we can move it out of the political and put it in the scientific and the medical arena. With this particular political group, 33% are of this particular group are unvaccinated. 33% of them that got vaccinated, 33% won't get the booster. So that's why our numbers are down so low. I think across the board, I think Derek may speak to it more broadly and more in depth. I think we had 62%. If we could get this partisan out of it and get those who are around 33% up to 62, then the rest of America will be up to around 85 or 90% boosted. And the mutation threat will be severely reduced. We will be to a place where if there's another outbreak, because we are vaccinated and boosted, that the hospitals now will not be overrun because of severe illness or death because of whatever virus come out. But we're not there. And now the Biden administration is beginning to say some of the same thing that the Trump administration said, that this virus is in our rearview mirror. With 2,000 Americans dying every day. It may be in their rearview mirror, but to me, it's still in the front view mirror.
I did some, and I'm gonna let Jared do some other numbers before we get to Derek, but we did, there's a 70% goal, I think a CDC has for the countries. And it says out of 100 countries, the US has fallen short of its goal. Now, some of the countries that have at least made 70% or over 70% is Canada, Brazil, China, Australia, the European Union, all have passed the target of vaccinating at least 70% of their population. But Africa is going to fall, the African countries will fall short along with America. So you're right, as far as we have not reached that 70% goal. Jerry, you have some other numbers?
I was just going to say, we've already passed we already at 900,000 as of today. They were saying it would be around April, but all you had to do was count the amount of people that were dying every day, because the uptick had it up almost at it was around 3,000 and something for 2-3 weeks. And so if it's up that high right there, I tell you, that's if you count, that's 15,000, man. You got to go 21,000 people, because they don't take off for Saturday and Sunday. So if the virus don't take off for Saturday and Sunday, you got 21,000 people dying per week times 4 or 5 weeks, depending on the month. So that's a lot of people that's losing their life unnecessarily, because of the lack of participating and and getting the vaccine. Mm-hmm. So right now we are over 900,000 according to the CDC, and we know that's a low count from what the study was months ago. From one of the colleges. So right now we're looking at possibly another 100,000 people by summer, if not more.
Mm-hmm. Well, say in Escambia County, I just have numbers for Escambia County. Confirmed cases in Escambia County is 76,642. Confirmed deaths in Escambia County is 1,159. So that's as of today,
Right.
February the 4th. So that's for Escambia County. And what about Florida cases, Jerry?
It's 5,590,000, and it's 65,000 deaths. That's
Well, it's always 65,993.
right.
That's 66,000.
Yeah, right.
Mhm.
Almost 6 million people that have been confirmed with the virus.
Let me
So-
jump in just quickly to say
Go
the
ahead.
numbers that you are reporting are slightly misleading because Escambia County and the state of Florida are back to a moratorium on reporting.
Mhm.
Oh,
So,
you're right.
Mhm.
so we're not, what you're seeing, like if you've noted, if you look at the trends for the last week,
Right.
Escambia County, for the last 2 weeks, Escambia County has reported zero new cases in the term.
Mhm.
Now, I know at least 5 people that have contracted within the last 2 weeks COVID-19. And if you recall, within that 2-week period, we've also had, I've forgotten his name just that fast, the gentleman who joined us to give his experience as an educator who had COVID-19.
Right.
Joseph Glover.
Mhm.
Numbers, he had tested positive twice. If you recall, he did that at home and then he did one with his healthcare provider. That number wasn't reflected in the next 2 days worth of stats. So the number is a little bit misleading for Escambia and as well as the state of Florida.
Mhm. So it's much higher than what the numbers are stating. That's
Now,
the word.
I won't speculate on deaths because I don't know if the death rate has gone up for Escambia County or even with the state. But I do know the actual confirmed number of cases is higher than what it actually is.
Mhm.
And you have to be right statewide because this been a number that's been out there for a while, the
Wow,
65,000. Yeah.
Wow.
So it's got to be definitely skewed backwards. You know.
So what do you have to report tonight, Derek?
Well, there hasn't been much. Again, just going back just yesterday, they touted again that this has been the most successful rollout. Again, and somebody else must have posed the question like I had, was like, well, what are you comparing it to? Because we haven't had a rollout of anything at this magnitude since the inception of the country. But we did discuss, and I don't know if we're going to be talking about the test kits. Dr. Williams alluded to it with Medicare. Somebody must have heard your cry. I did raise a point regarding the number of the 4 test kits that they're providing being a low number. So we now have a total of 8 that are going to be covered for those who are Medicare and Medicaid patients. I do want to, and I'm not sure what structure you have tonight, but I do want to make sure we cover insurance. I spoke with my insurance provider, and then they did talk about it in the call this week as well. I have, and I'll use mine. I have United Healthcare, and they have a home healthcare visit program that they do for their folks enrollees. I'm not sure what kind of plan you have to have, but they come out, do a physician assistant comes out to do an exam, just like you would go into the hospital to do, but they do it at home. During that, what he told me about United Healthcare, and I said, well, is it true about all? And he said, I believe so. If you have not been vaccinated, then their standard for the insurance purposes is first dose on beyond. So if you have not had any dosage of anybody's vaccine and you are unfortunate enough to contract COVID and you require hospital care, you're on your own. It's not being covered. Although it's now falling as a pre-existing condition, which I did know, and we all know that most of the pre-existing conditions are covered. COVID-19 is not one of them. And now the insurance companies are saying, if you are not covered, if you're not vaccinated or taking the appropriate steps to maintain yourself in a safe environment, as evidenced by vaccine of 1 dose, 2 dose plus the booster, they're not covering you. So if you have to get on a ventilator, I hate that anybody would be on a ventilator in general, but certainly on a ventilator at your own expense is ungodly high. And, unfortunately, if you're in a situation where you don't make it, you left another bill that's, ungodly high that your loved ones and family members are going to have to be responsible for paying for. So I just want to make sure that we all know that, because that's something that is, it was news to me. I thought, well, if you don't, whether you get vaccinated or not, they would cover you. They're saying no. And it makes sense, because the health, you have to think about it from an insurance provider standpoint. They have lost millions in this past 2 years, if not billions, in health and having to pay out expenses on behalf of their insured because of COVID-19. So from the business standpoint, I understand why they're making it. Hopefully it's a push in the direction to get others who still remain unvaccinated to get them to be vaccinated. But, at this point, you never know.
What about coverage? I think we brought this up too. What about coverage? If you have a job, will they cover you if you are unvaccinated and you get sick, you get COVID? Will your insurance still cover you? I think we talked about that a little bit last time. Is it still in effect that they have to still, I'm saying the business still have to pay out the premiums, the hospital premiums for that individual?
So as it stands right now, the answer to that question is yes. The specification that they've been making are for those in the examples that I just provided, or those who are private insurance carriers. So meaning that you're not necessarily getting it from your employer, whether you're on Medicare, Medicaid, or you pay directly, or Obamacare through that one of those agencies. Those are the ones that are going to be directly impacted if you are unvaccinated. For those who still have employment and use insurance coverage provided to their place of employment, they will still be covered. Now, if again, as we iterate, if for some reason you lose that coverage from an employer, meaning that you switch jobs or switch companies or whatever the case may be, you're laid off, and then you need to go to another Medicare or another insurance coverage, that's where you're going to have the difficulty in getting coverage going forward. If you have COVID or have had COVID, and that applies, then no, you're not going to be as successful in getting coverage. But if you have not had coverage, you'll be fine.
Do you think the premiums will go up? Because, just like smoking, remember that when if you're a smoker, then they gave you put on another level, and you had to pay more for your health insurance, business wise. So you think that'll happen soon?
I do, and I won't speculate, but I think in addition to those who are who may suffer, fall into the percentage group where they require hospitalization and they're unvaccinated, for those who still remain unvaccinated, I still believe that their premiums are going to go up. It hasn't been confirmed, and it's been a topic of conversation. Nothing has fully come out and been committed as this is public. This is where we're going with it. This is where all of the major insurance providers have said. But I fully expect that within this year, you'll start seeing, for those who remain unvaccinated, that their premiums will start seeing an increase in them.
We still need to emphasize the need for vaccinations, because vaccinations are dropping. We still need to push. What should we do? What can we say? I know they're saying it can stop severe illness. It can eliminate hospitalizations, even death. But how can we, as community leaders, ensure that we emphasize vaccinations and boosters? And I'm going to just ask that to the panel. What can we do? What are the solutions in order to continue to push?
I think what we're doing now is significant in helping to get the information out there as much as possible. Information like Derek just gave. If you're unvaccinated, it's a possibility you won't, your insurance won't cover you unless you are working on a job, and it may be hard to even get insurance after they find out that you've had COVID. So it's best to try to protect yourself in advance of it. And even if you get insurance, it might be so high that you may not, the affordability of it may not be available to you. So it's a lot in making sure that people are aware of what the condition are and what they may be and how it may be in the future as far as covering you. What we are doing by passing out home testing kits with Stay Safe Pensacola and pushing vaccines, continue to make people aware of why it's necessary, because there are so many ditches you can fall in as far as, and it's a life and death situation. It's people are dying every day unnecessarily. If they're telling you that, is a 98% chance that you won't die from this thing or end up in the hospital. But if you are unvaccinated, it's a 50% chance you will be in the hospital and on ventilator or maybe even death. So it's incumbent upon everybody to protect themselves and to look out for their loved ones and friends and family in the community as a whole.
Okay.
I just wanted to, because I know you mentioned it earlier, regarding the statistics. I was trying to find it as we were talking because I had it in my phone. For the Escambia County, total amount of individuals that we have that are partially vaccinated, which is just one shot or less if you're at the Moderna or the Pfizer, is 61.3%. Our total population that's fully vaccinated, and that's just either the one dose for J&J or both doses for Pfizer and Moderna, are 52.6. They've had what they say as less than 10% of total deaths reported within the last 7 days, and we've got 267 hospitalizations currently, and of that, over the age of 18, of those 267, 222 are above the age of 18. So still, the majority we're seeing is still above as adults, but there still are a significant portion of those individuals who are below the age of 18 still getting affected, which rings true if we start listening, if we see the examples of the individual that came to speak with us a couple of weeks ago, getting it from, students in his classroom.
But students 2 to 5 can now get vaccinated. What do y'all think about that, since they really don't have any data to look at to see if it's really safe or not? But what's your opinion about 2 to 5-year-olds getting vaccinated? Dr. Williams?
I think it's a very good thing. Keep in mind that virologists and scientists, they've been researching this for months.
For years.
What is that? Why don't they have data?
And they have the data, but what they're trying to do is to make sure of the efficacy and the safety of it.
The safety, right? Absolutely.
Will outweigh the benefits, and so they're fighting like about 10 fires on different fronts, and their focus for early on, their focus on seniors and people with pre-existing conditions. And so everybody was just trying to make sure, because they felt that those are the ones who are most vulnerable, and that those were to be the ones who are most likely to become hospitalized or die. And so the research that they needed, instead of doing on all the populace at the same time, they was focusing, but they did have a subgroup who was working on the children and working on the youth. They just didn't have as many people working on it. And so they have that data, but the FDA want a lot of data so that they can say, okay, what about this one person that perhaps got an ill or whatever? Is that 1 out of 1 million? That's 1 out of 10 million, whatever. So they can make it. And so they have that data. They being cautious. I think that it's a good thing. They got enough data now, and they asked for the green light from FDA, and it is expected to be approved within the next 2 weeks. And by the end of the month, that this shot will be in their arms. And so you can rest assured, in my estimation, that is a good thing. You want to get the popular little kids, especially you put them in nursery, you put them in these little pre-K environments. Those are little incubators for disease, from the flu, from all this stuff, and they gonna bring that back home.
Yeah.
Because they got a way, their nose are constantly running and they're touching and stuff. So yes, please get them vaccinated. This whole concept of vaccination is puzzling. I don't understand it. In my whole life, we never questioned vaccination, and now everybody questioning the vaccine. And if the data was before us today, and we will see the number of people who have died from this vaccine, I would eventually say out of the 200 and I think 10 million Americans that have been vaccinated, I would say less than 30 people have died from it. I'm just guessing. I could bring back anecdotal data, but I would say, let's just say 100 people died. 100 people out of 210 million. Yet 900,000 documented people died without it, and some with it. I don't even see I don't see it, Ms. Carol. I don't see it. I think we should embrace it fully and move forward.
I just want to say this. Before, when Joe Biden took over, it was as many as 5,000 people dying per day. 5,000. Imagine that. Before the vaccine, that vaccine has been proven that it works. The carnage stopped. The death trail stopped and brought it down. We was at 500 deaths per day at one time. It had dropped that low. But one of the things I'll continue to say is that we moved too soon in unmasking people and telling people, okay, we've overcome this. But there's always that group of people out there that can spread this thing much faster than the vaccine can possibly work. If people stop getting the test, and one of the things I think we stopped doing too soon was testing people.
Mhm.
We was testing 2-3 million people per day around the country, and all of a sudden it dropped down to a few 100,000, and then lower than that. And now we see the results of that. And behind this Omicron is is a stealth variant.
Mhm.
If we don't, I think they may have worked somewhat to kind of abate it, but we don't know what the significance of it's going to be. What is F2 or something like that? B2, but the
BA.2.
Yeah. So we don't know what the results of that going to be. How is it going to affect along with the Omicron, because the COVID haven't gone anywhere, Delta haven't gone anywhere. Now you got Omicron and all these variants that's possibly a mixed, that's going to be something that we really need to think about as much as possible. And like you said, Dr. William, if we had not made it this a political football, we know from vaccine it has killed. We stopped polio from spreading, and it didn't cure it, but it stopped it from spreading. And still, in some places you'll find it. It stopped the bubonic plague, smallpox, chickenpox, measles, the scarlet fever, malaria. All of these things is a result of vaccines and how we controlled it, and what it did to make sure that these things didn't get out of hand. And I think that there has always been people out there that was against vaccines. And I've said I didn't like the idea of giving vaccines to babies because when you look at the side effects of, the adults, they tell you when you take adult drug, there's side effect. But with this variance that's out here, this virus that's out here, this plague, if you will, it's affecting babies as well as adults. And so we're gonna have to find a way to make sure that everybody is tested and vaccinated as much as possible. At least get around 80 to 85%.
Well, we see, I don't know if y'all know that they're protesting in Canada. Do you know about them? They're protesting, they want to get rid of all mandates and all COVID-19 restrictions. It's a big protest, it's growing. And what do you think? I mean, they're saying get rid, they're tired of it. That's what they're saying. If we have more countries or states or cities and all that, people overall with this attitude, how are we going to get to the endemic part of it? Pastor always talked about endemic. How are we going to get to that, if ever, if we still have protests against mandates and COVID-19 restrictions?
We bear the burden of that responsibility because I think Canada is feeling the effects of a politicized environment that is being propagated throughout the United States. It's almost like they're getting the aftershock or the shock waves of what's going on here. And I think they're tired of their mandates. I think they're way more compliant in terms of vaccination status and doing what they need to do to maintain their safety than we are. So what's being, politicized here as anti-vaccinations, and to your point, to Dr. Williams' point, I'm not understanding, and I made the point last week, I think if you're an anti-vaxxer, you should be an anti-vaxxer all the way around. So that includes mumps, measles, rubella, scarlet, dengue fever, all of these other things that you currently give your children to go to public school in order to receive their education. If you're anti-vax, which I know a lot of people, not specifically necessarily in communities of color, but there's been a wave of anti-vaxxers in totality for a while now. Now this is as we've added this layer of vaccination, which, I'm not sure, well, I know where it is because of disinformation and misinformation and the result of the last of the former administration and all the antics and ongoings that they've had going on. And I think Canada is just saying, look, we're doing what we're doing. I'm tired of y'all being United States, messing up what we have to do. If we can maintain our level of safety, because I still think even if they were to lift their restrictions, I don't think that we would see this widespread mass of COVID that we're seeing in the U.S. when we lift restrictions in other cities and states. I mean, it's just, I think they're just tired of suffering the consequences that we're bestowing upon them unnecessarily.
I would like to add that along with you, Derek, is that if you're going to be an anti-vaxxer, be an vaxxer, be an anti-hospitalization person. If you get sick, don't go to the hospital.
Absolutely.
If you get COVID, don't go. So, okay, I grant that, okay, you don't want to get vaccinated. You still can make me ill, but don't you go when you get ill. But it's like a oxymoron. They totally against it. And then as soon as they get severely ill, they rush to the emergency room. And I don't want to point fingers, but I wish that the medical community would have made a greater stance, saying, listen, we're not going to overwork our staff because you don't want to get vaccinated.
Right.
I wish the medical community, they had came together collectively and said, listen now, we are the physicians, we are the scientists, we are the doctors. We are telling you this virus is deadly. We are telling you this, And if you don't want to believe us, then don't come for treatment.
Absolutely.
You know,
And I think that would have moved the needle so much quicker and faster if we could have had the medical community to join us in this fight. But I kind of think, and I could be wrong, I think they didn't want to get into political fray, that they get so much money from the government through these insurance initiatives that if the government cut them off, they now, man, stay out of that. You just gotta work. But look how many lives people dying because the hospitals still want to make money. And so that's my gut feeling. I don't have any anecdotal data to support my hypothesis, but I do believe that may have contributed significantly in shifting the needle for us getting out of this pandemic.
And I think you will actually see the hospitals are now starting to move to this side of the needle, where in the sense that there's been a large uptake in the trends of, you'll see people on lives now, whether it be through Instagram or Facebook Live or whatever whatever social media platform they're utilizing, talking about how they're shocked and appalled that their hospitals are sending them home without treatment when they have refused the monoclonal antibodies treatment. They're unvaccinated, and they're like, well, treat me with what? I mean, if you want a bunch of vitamin D shots, sure, but I'm not sure what exactly, if you're going against medical advice or AMA, what do you want them to do? And so they're like, I can't believe they sent me home. I'm just not, I don't understand. Well, what don't you understand? If you are not taking the treatments that are being prescribed or suggested to you as a patient, when you have no scientific training whatsoever, why are you surprised that that you're being sent home?
Absolutely.
I think that's to the point. I'll just mention, I had some of you know, I had appendicitis last week, and I had a little bit of difficulty getting into a room, and then eventually I got into the OR quickly, but I had difficulty getting in there because there are people sitting in there taking up space with
Can I tell you all a secret, Badera? Can I tell you a secret?
Yeah.
Now, I hope I think it's okay what I'm getting ready to say. If you need to go to the hospital, right, go to Baptist in Gulf Breeze. I'm gonna tell you why.
Why?
No, listen to me now.
All right.
Just a few days ago, I thought I was having a clot in my leg. I was going to Sacred Heart, and my wife said, "Don't go to Sacred Heart. You're gonna be in an emergency room 6 or 8 hours." She said, "Go to Gulf Breeze." I said, "Okay." So I drove over to Gulf Breeze that Saturday morning about 8 o'clock. I waited in the emergency room about 30 seconds. I didn't get a chance to sit down. Soon as I came in, they asked me to come up there. They got my information. They got my medical and everything. And I was on my way to sit. They said, "Okay, we finished. They'll call you back shortly." I was on my way to sit down, on my way to take my seat. They said, "Mr. William," and they brought me in, and I had a doctor. They did the ultra, everything on me, and I was back home in less than, say, an hour and a half. That's a secret now. That's
a secret. All right.
Let me say this. They were saying this morning on one of the channels that the people that was the anti-vaxxer leadership, they was getting huge amount of money to be out there spreading this disinformation and misinformation. Like you say, though, you know, there are so many people that have strokes, heart attacks, brain aneurysm, car accident, need lung and kidney transplant. Then you got the overworked doctors, you got overworked nurses and staff. they nobody think about them. Nobody think about the doctors, the nurses, and all of that are so overworked and overwhelmed by all of the death that they see. And you see it on social media and the news. People saying, I hope I don't have to zip up another bag, death, a bag with a body in it. So it's so many things that are happening that are causing a lot of people to suffer unnecessarily.
Well, let's go to, we have time is just running short. I want to talk quickly about the at-home test. Let's talk about that, and then I want to talk about the mask quickly before we need to talk about an event that's coming up on February 19th, and then to talk about our sponsors. So we've got kind of short period of time to do all of this in. But at-home test, Derek, give us an update on that. Roland, I still haven't received my at-home test yet, Derek.
That makes two of us. I have.
Well, I received
mine.
mine.
Either. I ordered mine the very first
You
day.
didn't receive yours.
I
The
still
Dr.
have
Williams,
not yet received them.
did you receive yours, Dr. Williams?
I did, but I only received 2.
Oh,
Mm.
oh,
Let me go.
okay.
I'm gonna go get them. Let me get them for you. I'm gonna show you what they look like. They're a little different from the ones we pass out. I'll be
Okay.
right back.
All right, Derek, so it's a little different from what we talked about last time, because now they've added Medicare and Medicaid.
Right.
And so, because we had concerns last week about the poor only being allowed 4 tests. So I'm glad to see that. I'm
And
really glad to
literally,
see that.
in our conversations, it was almost like, is Carol McIntosh on this call? Because there was a woman who was talking about the discrepancy based on the number of kids. For those who are communities of color, you've got multi-generational in one house, like the grandparents, the great-grandparents, the children, and the children of the parents, and 8 kit or 4 tests is not enough to cover. And I was like, wow, this sounds awfully familiar. If I didn't know it was your voice, I would have been like, I know Carol has joined our call.
Yeah, I sent those vibes all the way up to the top. Yeah, that's unfair. And so I was so glad to hear that they rectified that quickly.
Mhm.
And so can you just talk a little bit about the insurance part of it? We just want to keep saying it so people get comfortable in hearing it, about if you have insurance and if you don't have insurance, which would be the people on Medicare and Medicaid.
So there are now 3 options. I'll go through the first. The first one,
Okay.
again, if you go to COVID test, that's test is plural, so covidtest.gov. You can go on, I know we've talked about it, but just to reiterate, you can go on and successfully order 4 free at-home test kits. They are being prioritized in terms of high-risk areas first, followed in by communities of color and those with, I don't know how they determine where they get the information, but those with comorbidities or underlying conditions. Those are the prioritizations. Escambia County, unfortunately, but fortunately, is designated a high-risk area. So we should be, if you are calling or going on to the website to order the at-home test kits, you should be able to do so and receive them successfully. Now, we said that, although, you've heard we have not been, some of us, I know myself, have still yet to receive them, but I think they're still in mail en route. And they do give you a tracking number, so you can track to see where they are in terms of the postal service delivery. Now, if you're insured and you find yourself experiencing symptoms, you can also go through your insurance companies to order additional test kits where you can essentially purchase them, and your insurance company will reimburse you for the cost of those kits. So we're going at CVS, I saw some, I don't know if they're any cheaper, but I saw one for $109 online. There's some for $89. So those are pretty expensive, and depending upon, like the number of individuals that you have in your household, you may want to, plan ahead if you can. But if you can't, and you find yourself experiencing the symptoms, and the 7 to 12 day delivery time doesn't get you the test kits in time, certainly I would recommend using that option. And now, to the point that we were just alluding, we now have, for those who are on Medicare and Medicaid, you can order up to 8 kits. I believe it's monthly, if I'm not mistaken.
Yes, it is.
And so, which is a huge, to the point that you're making huge progress from the just 4 kits. That's it. That the rollout has already done. That this current rollout is at, to now getting 8 kits. And again, I'll emphasize for Medicaid and Medicare, that's 8 test kits for free per month. So it never hurts to go ahead and order them. If you have them, if you find yourself in a household that is large, has a large family, or you find yourself going out in public and you fall within that one of those criterion, then certainly I would recommend going ahead and ordering. It's the same process as I understand it now, that you do for the at-home test kits, the 4 free at-home test kits.
But I want to say this before Dr. Williams shows us his test kit. But I heard there's a problem with those test kits arriving because of the weather. There's a certain degree, 35 degrees. The test kits cannot be below that degree point, and so they don't want to send the test out. And then it's below 35 degrees and the test become null and void. So that's a situation, and people need to know that anyway. They need to know the temperature. They need to know they cannot leave test kits out in the cars if they're going to have a freeze or if it's going to be below 35 degrees.
And then also we have the problem with, we still, although they're making progress, our former administration put into the postmaster that's crazy as all get out, that's messed up the delivery times for everything from the U.S. Postal Service.
Yes.
So we're doing on 2 things, combating 2 issues that currently exist. So.
Yeah, right. Can we see a test kit, Dr. Williams?
Yes, ma'am. This is what the test kit looks like. It's about the size. You notice my hand is bigger than the test kit. And I misspoke. I said it only gave me 2. They only gave me 2 boxes.
Yeah, in the box.
In each box, 2 kits. I was expecting 4 boxes with 2 in each box, but that ain't what they promised you.
No.
They just promised you 2 kits. So it's a very small little box. Can you all see that?
Uh-huh.
And it looked like a CVS box, but it is not CVS. Up top of there, I mean, on this side, it says health. It says.
Right there.
Yeah, we see it.
Yeah, it said health, and got a little extra mark by that. Then it said COVID-19 and self-test at home, results in 15 minutes. And
Does
so,
it say who the manufacturer is?
right, that's who I was trying to show you. I think right here it's still look like estimation, upside down exclamation mark. Let me see. Can I show it to you? If I can bring it.
That's fine.
That's
That's
fine.
fine. If you got it.
Okay, maybe you can see. No, you can't see. It's health. It's like maybe that's eye health. Eye health.
Eye health.
Yeah, eye health. That's what that is. I thought it was mentioned, but that's just a little small.
That's eye.
Yeah.
Eye health.
Eye health.
Okay.
That's who are producing it.
All right, thank you so much for showing that to everybody so they'll know what the box is. Did it come in the mail? Did they knock on your door, or was it in your mailbox?
When I got home, my wife said your COVID kits are here. So I think that they put them on my door.
No, I think, well, you would be the first. Everybody else has got
The mailbox. Okay, I don't know. See, I don't know. When I hear she gave them to my Jamie.
They have a special relationship with your
Mr.
folks.
Williams.
Okay. It's probably okay. We're gonna move on. 720. You can ask the side, but it's probably in the mailbox. But
It's
I
probably
want
in
to
the
get to
mailbox. Okay, I didn't know. I didn't ask that.
yeah. It's 7:22, and I'm trying to get to the event that Stay Safe Pensacola is going to have February the 19th. We've talked about at-home test kits, and everybody has not received them. You know that at this point, if you have insurance, that some people can't afford them. The Medicare and the Medicaid part of it is coming. I think it's in the spring. So there's a little lull in between the time where everything is going to smoothly roll out. In between that time, then Stay Safe Pensacola is distributing test kits out to the public here in Pensacola. in the Escambia County areas. And so we've had a couple of events already. I'm going to tell you now about the event that we're going to have February the 19th. You need to come out and get your COVID test kits. And this is going to hold you over until you start receiving and your kits come on a regular basis. So we give out 2 test kits. I'm going to read this flyer to make it quickly. Community COVID-19 Clinic. We're working with the Deltas. And Dr. Williams, kind of quickly tell them about the event a little bit more. No, we're working with the Deltas. We're at their location. Dr. Williams.
Thank you, ma'am. On February the 19th, we'll be at the Delta Sorority House, downtown Pensacola, in the Belmont Cultural Center area. Once again, we'll be passing out 2 kits, but also they're going to have a vaccine clinic. Is there anyone that need to get a vaccine or get boosted? That's a good thing. We want you to get boosted, get your vaccine, but we'll have a little snack lunch, give you a snack lunch. We'll get you flyers. We just want to continue to try to move the needle to keep our community safe. So put it on your calendar from 11 to 2 a.m. on February the 19th.
Like Dr. Williams, we like to show things because we want you to make sure you know what everything looks like. These are the kits you will receive from Stay Safe Pensacola. You can see it'll be 2 kits in the bag. We also have a vaccination card holder. I've told y'all 100 times, those vaccination cards are going to be very, very important. We have some hand sanitizer that we're going to give you. We also have some resource information as well as directions on how to administer your at-home test. Along with, like Dr. Williams said, food and your vaccination. So that's February 19th. It's going to be a wonderful day. Come on out.
And that address is 601 West Belmont Street. That's 601 West Belmont Street for everybody here locally. Like it says, from 11 to 2, Saturday the 19th, 11 to 2. And it's sponsored by Stay Safe Pensacola, Move for Change. And our partners, WBQP TV, WRNE 980 AM, and Choice 106.9, the McIntosh Principal, the Delta Sorority, the City of Pensacola, along with Grover Robertson, who is the mayor here. So we want to make, and Caring Heart, who is another partner who partner with us, collaborate, and the health department that collaborate with us. So we want to thank all of those who will be involved and then continue to be involved with us.
Well, we really want to thank the Deltas, and Dr. MC will have something if they're looking at this show tonight, and we're going to have them on February the 11th. We're going to have them actually come on from the health department. We're going to have CVS and someone from Walgreens, because they're going to be out there administering the vaccinations that day on February 19th. So we're going to have them on the show next week. And we're going to have, is that Dr. Grimes? Dr. Williams?
Greer Hall.
She's going to be on February the 18th to also discuss about the importance of vaccinations and to talk about the program that the Delta Sorority and Stay Safe Pensacola, along with Move for Change, will be putting on.
Oh, and also they will be administering the vaccine as well. They will be giving out the shot. We want to make sure we stress that.
Yeah.
That the vaccine will be given that day as well.
And so you'll see flyers. We're going to flood the social media. It'll be on the radio and TV. So you'll be hearing more about it. But if you want to go online and get the at-home test, Derek, do you have that online website?
Yes, it is www.covidtests.gov. You can go online.
And what is that? You got that number with you also?
I knew you would ask me about it. I think I
I
saved
have the
it.
number. I
You
have
the
it.
number.
I
Okay.
have it. It's 1-800-232-0233, 1-800-232-0233.
You might want to say it again a little
And you
slower.
can call, I will say can call if for some reason you feel that you're out of the 7 to 12-day window for the test and your kids haven't arrived, they can assist you at that telephone number as well.
Okay, so last words, I'm gonna give my last words to our Director of Safe Pensacola. Please tell everyone why they need to still get vaccinated. And a few words.
It's not too late
Too late.
to vaccinate.
Oh my goodness, that was too, he did that to me last week. He sure did. I was just waiting. He says, and say it again, because I like that. We need to
It's
use
not
that.
too late to vaccinate.
Yeah, I need a t-shirt with that on. I like that. It's not too late to vaccinate. We really, that's what we were talking about, solutions. Wear that on a t-shirt. It's not too late to vaccinate.
Let's make some up. Let's get some out.
Let's get that done. I like that a lot. Derek, at the White House task force.
I just want to say I echo his comments as well. I won't be too brief, but I do want to make sure that everybody knows the masks, the free mask in 95s, because we hadn't talked about it today. They're available. Got to check. CVS will have some in stock. CVS and Walgreens will have some in stock next week. They were at Sam's, both here and in Okaloosa County, and they were gone in 30 minutes. So they're
at Winn-Dixie as well.
Yeah.
They're in Winn-Dixie. I went in today. Well, I had gone in earlier and I got a couple of masks, but then I went in today and they were all gone. That's over 2,000 masks they had just in that location, Winn-Dixie location, and they were all gone. So
I just advise people to check every day if they can,
Yeah.
So you have to check every day and get out there and get them. Well, you all, it's been a great show. That hour goes by so fast, but we have such good information and things change every week. So every Friday you will see Let's Talk COVID on Facebook Live with Derek Scott. You'll see Dr. Isaac Williams, and you'll see Jerry and Carol McIntosh, that's us, and other special guests that we might have to let you know that COVID is still a topic that we need to talk about. It's still very important that we take our vaccinations, we get our boosters. It's still very important that we stay safe and we keep our distance. Everybody, we can't let our guards down. We can't stop now. We're almost to the end, as they say. We hope, but it can turn around and at any second. Jerry.
Yeah, just want to say people are saying they're tired of the virus. So are we. I think everybody is tired of it. But the thing about it, it's not tired of us until everybody is protected. And tiredness is not going. It's not a solution. What's the solution? Wearing our masks, getting the vaccine, and trying to get to some kind of herd immunity.
If you have any questions, concerns that you want to ask us, feel free to call any one of us, to email or text any one of us, and we will put that question on the show. We'll make sure that we answer it for you. We're here for you all. We're here to make sure that you're comfortable and feel safe and be empowered in how we're going to handle this situation. Dr. Williams, so glad that everything went well with you and wasn't anything major. Glad to hear that. And we're going to see everybody next Friday on Let's Talk COVID. Also, Jerry, talk about the show Sunday.
Community awareness, not community awareness, community conversation this Sunday at 7:00 p.m. Central, 8 Eastern. And every Sunday we are on either Our Voices or Community Conversation. You can go to themcintoshprinciple.com and click on Facebook and catch all the shows. And make sure every Friday we are on there on Let's Talk. Let's talk COVID.
Good night, everybody.
Thank you, Brother Vernon at WBPQ TV.
Oh, yeah, that's right. We can't forget WBQP TV. We on right now on WBQP TV. So thanks, Vern.
All right, then.
All right.
All right, y'all. Good night.
Good night.